job is the way like I would go into a room. So I introduce myself and I say, hi, my name's Kayla. I'm gonna be your phlebotomist today. We're gonna be taking your blood, and then you make sure that you get their consent, and usually yes is like okay. And then you go ahead and verify their name, their first and last name. So can I get your first and last name and your date of birth?
Kelly Hernandez, 3/16/74.
Okay, perfect. And then you go ahead and you start setting everything up past that point, okay? You don't want to touch the patient until you verified everything. Normally they'll have like an armband, you'll have like their requisition right in front of you, and you'll be verifying it like that. So then you'll go ahead and you'll check around and look for their vein. Go ahead and you want to always kind of take control in a way, and like if they're not doing something that you want, you just reposition their arm. You always want to have it in like a downward motion as well, because it'll give you like better vein like flow to find a vein. So here we go. And if it takes you a while, you also want to like take the tourniquet off, reapply it before you go ahead, because you don't want to leave the tourniquet on too long. Normally I just leave it on because I usually get through it pretty quick, but so then you're going to clean. And then always concentric motion, so you start in the middle and work your way outward. Let that dry, and then usually these are like separate, but this one's together, so it makes it pretty easy for you to set up everything. Make sure all your tubes, I always try and put my tubes in like the order that I'm gonna draw it in, so that it makes it easier as you're grabbing them so you don't forget. Then go ahead and get some tape ready for you when you're done. Then I'm gonna go straight in. And you always want to anchor your vein really well, okay? Because it's going to help you give no pushback with the skin, okay? So here we go. 1, 2. Slide that in really easily. You also want to use this part of your, the end of your needle right here to make sure that you're pushing and pulling. You're always keeping this hand anchored down really well. Push. And then since this is your last tube, you're gonna pull that tourniquet, you're gonna pull that tube, you're gonna grab your gauze, pull, push, activate your safety always, and then you ask the patient, can you put pressure for me? Then you're gonna always throw this away into your sharps container before anything. Then normally what you would do, you wanna invert your tubes. So however many times, you know, it's normally about 8. That's what I do just for the average, to make sure that they're all mixed correctly. And then you go ahead and label your tubes. You're always labeling them from, like, when you're grabbing it with your left hand, you're gonna fill it out like that. First, last name, date of birth, their ID number. You're gonna put your initials, your ID number that usually your hospital or wherever you work gives you. Then military time always, okay? And then you go ahead and take your tape. Go ahead and you're gonna check and make sure that it's not bleeding when you lift it up for an extended amount of time. Go ahead and hold that for me again. Tape it pretty good. And then say thank you, have a great day. And then that's it. So, you guys have any questions?